Welcome to the Ultimate Upper Limb Muscle Challenge. I'm Joshua, and today we're testing your knowledge of the muscles from your shoulder to your forearm with a rapid-fire quiz. 15 questions, 10 seconds each. Ready? Let's dive in! First question, let's dive into the fascinating mechanics of your shoulder. Have you ever wondered what allows you to lift your arm out to the side as if you're reaching for something on a high shelf or waving to a friend across the room? This movement is called abduction, and it's a fundamental action that we use countless times every day, often without even thinking about it. So, when you lift your arm out to the side, performing abduction, which muscle is the primary mover responsible for this action? Take a moment to think about it. Imagine the muscles working beneath your skin, coordinating to make this smooth motion possible. You have 10 seconds to consider your answer. Time's up. The answer is the deltoid muscle. This powerful triangular muscle sits on the outer aspect of your shoulder, giving it that rounded contour. It's not just for show. The deltoid is essential for a wide range of arm movements. The middle fibers of the deltoid are perfectly aligned for abduction. They take over after the first 15 degrees of movement, which is initially started by the supraspinatus muscle. Once you pass that initial range, the deltoid's middle fibers become the main force, lifting your arm higher and higher with remarkable efficiency. If the deltoid is weak or injured, your ability to lift your arm is significantly limited. Everyday tasks like reaching, lifting, or even dressing can become challenging. That's why maintaining deltoid strength is so important for shoulder health and overall mobility. The deltoid muscle is innervated by the axillary nerve, which branches from the brachial plexus. This nerve provides the signals that allow the deltoid to contract and perform its vital role. Damage to the axillary nerve can lead to deltoid weakness or even paralysis, underscoring the importance of this neural connection. Clinically, we test deltoid strength by asking a person to abduct their arm against resistance. This simple test helps us assess both muscle function and nerve integrity, providing valuable information about shoulder health. Did you get it right? If so, great job. Understanding the deltoid's role is key to mastering shoulder anatomy. Let's keep going and explore more about how your body moves. Next, which muscle initiates the first 15 degrees of shoulder abduction before the deltoid takes over? 10 seconds. The answer, supraspinatus. It's a rotator cuff muscle, starting abduction and stabilizing the joint. Tears here are a common cause of shoulder pain. Remember, supraspinatus gets the movement started. The biceps brachii, famous for flexing, but what are its two main functions? 10 seconds. Answer, elbow flexion and forearm supination. It bends your elbow and turns your palm up. Think sup for supination. Most powerful as a supinator when the elbow is flexed. Both actions are crucial for daily tasks. Which muscle prevents scapular winging and is innervated by the long thoracic nerve? 10 seconds. The answer, serratus anterior. It protracts and anchors the scapula, essential for pushing an overhead movement. Damage to the long thoracic nerve causes winged scapula. Remember, serratus anterior keeps your scapula flat. Which muscle is a powerful medial rotator and adductor of the arm? 10 seconds. The answer, pectoralis major. It brings your arm toward your body and rotates it inward. Think bench press or big hugs. Both heads work together for strength and versatility. Pecs are key for pushing and climbing. The flexor digitorum superficialis flexes which finger joints? 10 seconds. Answer, proximal interphalangeal PIP joints. It also flexes the metacarpophalangeal MCP joints, but not the distal ones. To test it, hold other fingers straight and flex at the PIP. FDS equals sign PIP flexion. Welcome to the rotator cuff edition. Here's a quick challenge for you. Which of these muscles is not a part of the rotator cuff? Supraspinatus, infraspinatus, teres minor, or teres major? Take a moment to think about it. You have 10 seconds. If you guessed teres major, you're absolutely right. While all four muscles are located in the shoulder region and play important roles in arm movement, only 3 of them are actually part of the rotator cuff group. Teres major, despite its similar name and close proximity, is not included in the rotator cuff. The true rotator cuff muscles are remembered by the acronym SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles work together to stabilize the shoulder joint and allow for a wide range of motion, including lifting, rotating, and reaching overhead. Each muscle has a unique function, but together they form a supportive cuff around the head of the humerus, keeping it securely in the shoulder socket. Now let's talk about teres major. Although it's located near the rotator cuff muscles, teres major is not part of the cuff. Its main actions are adduction and medial rotation of the arm, helping to bring your arm closer to your body and rotate it inward. It works closely with other muscles, but stands apart from the rotator cuff group. It's easy to mix up teres major and teres minor because of their similar names and locations, but remember, teres minor is a rotator cuff muscle, while teres major is not. Teres minor helps with external rotation of the arm, while teres major assists with internal rotation and adduction. Keeping these differences in mind will help you avoid confusion. If you identified teres major as the odd one out, great job! Understanding the anatomy and function of these muscles is key for anyone studying the shoulder. Keep practicing and you'll master the rotator cuff in no time. Which muscle is the chief extensor of the elbow? 10 seconds. Answer: triceps brachii. Three heads converge to extend the elbow. Think push-ups and throwing. Innervated by the radial nerve. Injury here means weak extension. Triceps equals sign elbow extension powerhouse. Which nerve supplies most anterior forearm muscles? 10 seconds. Answer: median nerve. It innervates most flexors and pronators except flexor carpi ulnaris and part of flexor digitorum profundus, ulnar nerve. Median nerve injuries affect grip and wrist flexion. Remember, median nerve equals sign main forearm flexor supply. What's the primary function of the brachialis muscle? 10 seconds. Answer: pure elbow flexion. It lies deep to the biceps and flexes the elbow in any forearm position, most powerful when the forearm is pronated. Brachialis is the workhorse of elbow flexion. Don't forget this underrated muscle. Which muscle lies deep to the biceps brachii and flexes the elbow? 10 seconds. Answer: brachialis. Again, it's deep, strong, and always flexes the elbow regardless of hand position. Biceps and brachialis work together, but brachialis is pure flexion. Know your layers. Which muscle is responsible for thumb opposition? 10 seconds. Answer: opponent's pollicis. It brings the thumb across the palm for gripping and fine motor tasks. Innervated by the median nerve, injury here means loss of opposition. Opponent's pollicis equals sign thumb dexterity. Which muscle is innervated by the axillary nerve? 10 seconds. Answer: deltoid. The axillary nerve wraps around the surgical neck of the humerus. Injury here weakens abduction. It also supplies teres minor, but deltoid is the main mover. Loss of axillary nerve equals sign weak shoulder abduction. Deltoid and axillary nerve key pair. What is the function of the extensor carpi ulnaris? 10 seconds. Answer: wrist extension and adduction. Ulnar deviation. It lifts the back of your hand and tilts it toward the pinky. Works with other extensors and flexors for wrist movement. ECU. Equals sign extension plus ulnar deviation. Which of these is in the posterior forearm compartment? Flexor carpi radialis pronator teres extensor digitorum, or palmaris longus. 10 seconds. Answer: extensor digitorum. It extends the fingers and wrist, originating from the lateral epicondyle. The others are anterior compartment flexors or pronators. Posterior equals sign extensors like extensor digitorum. That's a wrap on the ultimate upper limb muscle challenge. You've just taken a big step in mastering the complex anatomy of the human arm. Whether you aced every question or found a few tricky spots, remember, every attempt is a win when it comes to learning. The more you practice, the more these details will stick with you. So, how did you do on the quiz? Did you surprise yourself with how much you remembered, or did you discover some new areas to focus on? No matter your score, you're making progress. Each question you answered helps reinforce your understanding of muscle names, locations, and functions. We'd love to hear from you. Share your score in the comments below and let us know which muscle group challenged you the most. Your feedback helps us create even better quizzes and resources for you and other learners. Remember, learning anatomy is a journey, not a race. It's all about building your knowledge step by step and reinforcing what you know. If you missed a few questions, don't worry. Review the material, revisit the diagrams, and try again. Every bit of effort counts and brings you closer to mastery. Keep practicing, stay curious, and don't forget to check out our channel for more quizzes, in-depth anatomy breakdowns, and study tips. We're here to support your learning every step of the way, whether you're a student, a professional, or just passionate about the human body. If you enjoyed this challenge, make sure to subscribe for more content. Flex those brain muscles regularly and you'll be amazed at how much you can learn and remember. Thanks for joining us today. Keep up the great work and we'll see you next time.